Welcome, folks, back to another episode from the Alka Ohri Foundation, the holistic approach to the treatment of breast cancer. Well, today we have a special guest that we invited, Dr. Neil Iyengar. And I've asked Neil to join us at this podcast because he is very instrumental in terms of some of the programs that we are running. One of the programs that he's leading for us, a research project that he will talk more. But I think to start with, Neil, it will be good to kind of introduce yourself and your background and how did you come into integrative oncology area.
Absolutely. So thank you for having me on, Ajay. It's a pleasure to be here and talk about our partnership between MSK and the Alka Ohri Foundation. So I am a medical oncologist by training and a physician scientist, which means that I spend some of my time seeing patients in clinic and I spend the other part of my time doing research. And this setup has really helped to inform the research that we do by understanding what are the struggles and some of the problems that patients are dealing with on a day-to-day basis when they're diagnosed with breast and other cancers.
Right.
And you asked what brought me to this area of whole person care and research in this area. Well, it actually came from a very basic science underpinning.
Really?
Yes. I was part of a couple of laboratories during my medical training and initially after I graduated,
Okay.
to really understand the biology of how our system as a whole, hormones, other molecules, inflammatory molecules, proteins, and so forth, interact with our cells to either promote the development of cancer or promote resistance to cancer therapy. And after spending a long time understanding that biology, it became clear to me that a lot of the tools for reversing that bad biology and improving cancer outcomes we already have, and those are lifestyle interventions.
Oh, okay. So, how are you incorporating this in your in today's environment? And has that been? I think one of the things that I've come to realize from Alka when she was a patient, we were never introduced to integrative oncology, and I think more and more that I'm studying, I'm more fascinated by this aspect of the medicine, which is not known to a lot of people. So I think the question is twofold. One is, what are you guys doing in terms of increasing that awareness? Number two is, how are you doing that?
Yeah, these are great questions. And I think, to your point about a lack of awareness, I actually think that a lot of that stems initially from a lack of data.
Okay.
And, as I mentioned earlier, first and foremost, I consider myself to be a physician scientist. And part of the issue was that we know that paying attention to your lifestyle and bringing in integrative approaches helps to make people feel better, which is important. Of course, that's important. But there was a lack of data, and still to some extent is, but we're working on it with you, to understand how these interventions do actually impact cancer risk and cancer outcomes. So over the last decade, I would say, there has been a proliferation or a large amount of data coming out indicating that things like exercise, diet, your sleep patterns, your stress patterns do directly modify or alter the biological signaling in our body and can impact cancer outcomes. So I would say on one level, awareness is now increasing because those data are now being reported and oncologists now can better understand why these interventions have real impact on cancer. On the other hand, now we've got to get that message out so that patients are aware that these types of interventions and integrative oncology is available. And if it's not available at one center, it's available elsewhere, and there are resources to be able to pursue this.
Right.
So I agree with you that awareness could be improved and needs to be improved. Right. And I think that's happening, but it's critical that we continue generating the data showing the benefits in order to really bring on more people to this beneficial approach.
What triggered, that's a good point you mentioned, Neil. What triggered MSK to include integrative oncology group? There has to be some value addition that they see. Otherwise, they wouldn't bring integrative oncology. So, what is that, uh, purpose, or I would say the benefit that the MSK team, the MSK management looks at it?
Yeah, absolutely. So I'm fortunate to be at a place like MSK because our institution has a very rich history,
Right.
Dating back to the Rockefellers with regard to support of integrative oncology. And so we have one of the first integrative oncology departments in the nation.
Really?
Absolutely.
I didn't know that. Really?
Absolutely.
Wow. Okay.
So MSK has fortunately been very focused on the integrative approach. I think in recent years we've seen more expansion of integrative oncology and now better integration of integrative oncology into cancer care, partly because of the data issue we were talking about earlier.
Right.
We now have more data to support its use, but also because of patient-driven interest. And I think that's critical as well. We can partner with you guys, with patient advocates, to really make it clear that this approach not only helps people feel better, but we're starting to see helps to improve cancer outcomes, so we can bridge that gap even within our institution between an integrative oncology department and the medical oncology group.
So does MSK has a patient advocacy group also, and what are they doing about closing that gap also? Because they also have to kind of promote you guys to bring that at the forefront, because what I see is that at the patient entrance level, I don't think the patients are made aware of the integrative oncology group is also available.
So this is such an important point, right? Because we can have all of these resources,
right,
and then if we're not actually offering it or patients are not aware of it, what's the point?
Right, exactly.
So I think what you raise is a critical question, and so here at MSK we do have patient representatives, patient advocates. We have a patient-led group that was essential in helping us launch the Healthy Living program,
right,
which is something that I'll mention now. The Healthy Living program
right.
is really an initiative to address the issues that you brought up, and that is to bring these resources, whole person care, available, make them available to the patient
right.
at the time of their cancer diagnosis, rather than the traditional model of waiting until a person has either completed cancer therapy or is on a break from cancer therapy. What we find, again, because of the data, is that the earlier we bring in whole person care models and integrative care, the better the impact of those treatments on patient outcomes. So I would say through a combination of partnership with patient advocates and with our own groups here, as well as launching the Healthy Living program, that has really helped to raise awareness and bring these resources.
I'm glad to hear that, because I think that would be very helpful for a lot of viewers who are watching this podcast, and I think it's important for them to kind of understand as to what integrative oncology brings to the table. And it would be a good idea for them to even bring that to their oncologist when they speak to them. But let's talk about the research that you are spearheading. That Alka Ohri Foundation is supporting. Can you talk about that research program, the protocol, and also what sort of outcomes you are expecting, and what would that do to benefit the future patients?
Absolutely. So we
or the current patients, sorry.
and the current patients, current and future.
Yeah.
Pardon me. Current and future patients for sure. So we're very grateful for the support from the Alka Ohri Foundation, because this is really helping to propel research in whole person oncology care. And one of the things that we realized early is when we are studying lifestyle interventions,
right.
This is a difficult area to study because it touches on so many different biological aspects, social aspects, and just the individual variation between people can add a lot of variables that make it difficult to isolate an effect of these interventions. So we learned very early that we need to be very precise about the way that we study these interventions, almost in the way that you would study a new drug. And in order to do that, we need to use the same clinical trial setup, design, machinery, and staffing and scientific testing
Right.
that we do when we develop a new drug. Of course, that is a large endeavor, which is why support from the Alka Ohri Foundation is so important, because it helps us to do this in a more rapid pace. So we are using research protocols where we measure the outcomes of these lifestyle interventions in a very similarly precise way that you would measure the effect of a new drug. We're also delivering the lifestyle intervention in a very precise, individualized manner, because we again recognize that the type of lifestyle intervention that is helpful for one person may not be helpful for another person. So that's where we actually differentiate this research from drug research, where you're using essentially the same drug for everyone.
Right.
That's not the case for lifestyle interventions, obviously, and that adds another layer of complexity. But if we can do that, if we can be precise about the way that we prescribe the lifestyle intervention and make it individualized, and be precise about the way that we're measuring outcomes, that will really propel the science, and it has started to do so already, in a way that will make these programs more broadly available to our patients.
Thank you, Neil. I think for our viewers, can you elaborate on the lifestyle interventions? What are those?
Absolutely. So the lifestyle interventions really encompass a broad spectrum of domains or areas in a person's lifestyle where we have or are developing interventions to improve that domain. For example, we know that people who are more physically active feel better during and after their cancer therapy.
Okay.
And there's preliminary evidence.
And we have documentation, we have articles and studies shown where the exercise has, in some cases, revert cancer also.
Yeah, exactly. You read my mind. So we have preliminary evidence that exercise may actually have anti-cancer activity, that it can fight the cancer in conjunction with standard cancer therapies. It might even reduce the development of resistance to standard cancer therapies and thereby improve cure rates and help people live longer.
Right.
So we're certainly studying individualized exercise prescriptions for patients. Very similar story with nutrition.
Okay.
Although nutrition is even more complex to understand, but we can be precise about it, and we can not necessarily isolate specific foods, but rather overall eating patterns, either the timing of eating or the general type of diet a person is consuming, and how that might impact how they feel, the response to cancer therapy, and their cancer risk.
This is where I have a question. You know, when Alka was going through, and we had a nutritionist, and there was not too many out there in MSK. At one of the sites, we had nutrition. She basically gave us a pre-printed menu, and I think, like you said, that the nutrition piece is very complex, and so to each patient it's a different diet. How do you then, is MSK looking into customizing a nutrition program for these breast cancer women or cancer people? Because I think that's very important. Because anybody could print out a PDF from Google and so this is the menu to lose weight or what have you. But cancer is as such, you can't just give a one standard menu.
Yes, this is a very important issue, and I think part of what you've identified here is the difference between guideline-driven care and individualized care. Right. And so what we have right now are a set of general nutrition guidelines which sort of give you the basic do's and don'ts of what to eat or what not to eat during cancer therapy. And unfortunately, it's very generic, and very understandably, when a patient receives that information, many folks will say, I knew this already. Or I'm doing this already. Right?
That's true.
So what we're doing now, and we've brought on research dietitians and additional dietitians who are moving beyond that sort of guideline-driven care and really researching areas where we can provide more specific guidance. I'll give you an example. We just completed a clinical trial which is looking at a plant-based diet plus structured exercise for women with stage 1 to 3 breast cancer.
Oh, wow, okay.
And even though everyone consumed a plant-based diet, we were very specific about the nutrition. So every week, each trial participant got an individualized caloric intake goal, which also told them what their breakdown of protein and carbohydrates and fats should be, and other nutrients, macro and micronutrients.
Really?
On a weekly basis, very, very personalized. We even shipped the foods to patients.
Okay.
This was, again, part of a controlled research trial. So we were able to pre-make the foods in an individualized way for that person, and then ship it out to that individual on a weekly basis so they can consume the foods that we were prescribing. They were then trained to be able to do this on their own after they completed the clinical trial.
How long was the trial?
It was a 6-month intervention.
Okay.
And then patients were trained to go on after the intervention to do that on
So
their
MSK
own.
basically delivered the diet, I mean the plant-based food to them.
Yes,
so
as part of the clinical trial, we delivered the meals.
So the outcome is the results are out or not?
The results haven't been published yet.
Okay.
They will be soon. We published or reported the initial results at the American Society of Clinical Oncology this past summer.
Okay.
And essentially what we found was in individuals who consumed the plant-based diet that we prescribed and participated in the structured research that we prescribed, they lost about 14 to 16% of their body weight before starting.
Okay.
Which is remarkable. That's the amount of weight loss that we see from the new weight loss drugs that are being prescribed. But this is a sustainable, lifelong intervention. So we were, very excited to see that amount of weight loss. We had a less intensive arm where patients were educated and guided on what to do, but we didn't provide the foods for them. And even in the less intensive arm, patients lost about 4 to 5% of their weight.
Did that have any impact on the tumor?
Great question. So that's what we're studying now.
Okay.
So all of these participants were wonderful and volunteered breast biopsies before and after the intervention. We've got blood tests. We've got stool for microbiome studies.
Okay.
So we'll be able to do, and we are currently doing, a lot of analyses on all of these tissues.
Right.
So eventually we'll be able to report at a very deep biological level what this kind of intervention and what this kind of weight loss does to the processes in the breast tissue and in the body as a whole.
That's interesting. I didn't know that you guys were doing this trial. I think this sounds very encouraging, because I think to the viewers, obviously, being vegetarian, or in some cases vegan, is very healthy. One of the things that I keep hearing is increase your protein intake. Can you define that a little bit more? Because you want to eliminate sugar out of your system completely, especially patients who are cancer. Otherwise, also, I recommend not to eat sugar. But then how does the impact of protein, and what kind of a protein they should be having? This is a little bit more technical, but I thought, let me check with you.
Sure.
What are your thoughts on that?
Yeah, so, I would start by saying this is where individualization is really key, right? Because in general, most of the American public actually eats more protein than they need. But this is where we see a lot of individual variation. And so some patients with a cancer diagnosis do need more protein, because for certain types of cancer, they could be dealing with muscle loss, cachexia or sarcopenia, which are different forms of muscle loss that can either be induced by the cancer itself or by the cancer therapy.
Right.
So understanding if a person has that issue will guide whether we're recommending more protein or not for that individual. For other individuals who have an adequate amount of muscle mass, it may not be so much their protein levels in isolation that are necessary to boost, but rather their protein to carbohydrate ratio, which again goes back to that concept of the first starting block of nutrition is to consider your overall eating pattern and are things in balance before we start getting to very specific nutrients or food types.
Okay.
Now, to your question about is there a specific type of protein that we should strive for, again, I would say that we can get plenty of protein from plant-based foods. There's a misconception out there that you really need to eat meat to get protein.
Right. I'm glad you mentioned that, because that is a big sort of a myth or a mindset.
Absolutely. It's not necessarily true. Now, it is true that some plant-based proteins can be more difficult for our bodies to break down and absorb. But again, that goes back to how much of it are you eating, what other foods are you eating, fiber, for example, that can help with that digestion and so forth. But that being said, I would say for now, I am a proponent of plant-based diets and plant-based sources of protein. But until we get more data for those people that do eat meat, I think it's reasonable to say, as long as you can strive for about 80% of your intake coming from whole plant-based foods, and if you do eat meat, limiting that to about 20%,
right,
and making sure it's minimally processed lean meats, right now the data would support that approach as well.
That's I'm glad we talked about that. So I think, how can families and caregivers advocate for integrative medicine options if they aren't initially offered or discussed? So I think that's an important area, because they don't know.
So I would say that the work that we're doing here, the work that the Alka Ohri Foundation is doing to bring awareness to the availability, or at least the need for integrative and whole person care after a cancer diagnosis, or frankly even before a cancer diagnosis, is so critical, right? And so the most straightforward thing that you can do if you're a patient or a family member of a patient with cancer is ask your oncologist right off the bat. Don't feel like you have to wait.
Okay.
Or a lot of people will think that we need to prioritize the cancer therapy first, which is true, but it doesn't mean that things can't be done in parallel. In fact, our data suggests that it's best to do whole person care in parallel at the beginning with cancer therapy. So the number one thing that we can do to improve awareness is actually partner with patients and encourage folks to ask your oncologist about the availability.
And they should not they should not feel shy or feel that the doctor will get offended. I think this is something that they should learn and educate themselves by asking them a question. But tell me about the integrative oncology.
Absolutely.
Because I think that's important, right?
It's so important. And I think, many oncologists are now bringing this into their standard of care practice.
Okay.
Certainly this is what we've done with the Healthy Living program at MSK. We now offer integrative medicine services right at the beginning, right at the time of cancer diagnosis.
That's good to know. I think we need to be more aggressive on that, politely, to have these patients know about the integrative oncology group. I think we had a good discussion, Neil, today. I think looking ahead, what is your vision for integrative medicine in cancer care, both at MSK and beyond?
So I think generating more data is very critical, and again, why the partnership with the Alka Ohri Foundation is so important, because that is helping us to generate more data. The more data that we have, the better of an understanding we will have about which approaches are the most useful. Because again, if we think about it from the perspective of a patient or even the oncologist, when somebody's diagnosed with cancer, there's so much to do, right? And prioritizing all of the different things that someone needs to accomplish is actually really important. And the more data that we have with regard to integrative oncology and whole person care, which so far is showing us that it needs to be a priority right up front, the better the oncologists will be at creating care plans that include integrative and whole person care, and the more empowered patients will be for requesting these services. So that's what I see moving forward, is that we will continue generating the data that help us establish programs like the Healthy Living program that bring all of these resources in an individualized way up front at the time of cancer diagnosis.
Well, thank you, Dr. Iyengar. I think this was a very productive discussion we had, and thank you for your insight. And Alka Ohri Foundation is really proud to partner with you guys, because I think you're bringing a lot of value in terms of the holistic part to combine that with the treatment. And I think some of the lifestyle intervention that you talked about are very important. Exercise, proper nutrition, getting guidance from their oncologist, and but combining that with the integrative oncology group. And then meditation and yoga, without saying, becomes a very integral part of their treatment. And also, I would like to plug in over here that women who have a pre-existing family conditions, they should also be, if there's a woman in the family and they don't have breast cancer, the data indicates that 1 out of 8 women are more than likely to get breast cancer. So I think we want to educate them as well as so that they can change their lifestyle accordingly. But thank you so much. And I think there's a lot more to talk about, but I think more data comes out, we'll have more conversations. So I appreciate your time. Thank you so much.
My pleasure. Thank
Yeah.
you for having me on.
Yeah, great.